We're at the Mackinac Policy Conference on behalf of the Michigan Health and Hospital Association and the Common Bridge podcast and Substack page. I'm your host, Rich Helppie, and we have with us today Tonya Darner. She is the Market Chief Executive Officer from the Upper Peninsula Health System in Marquette and Bell, if I got that right.
That's correct.
Very good. Tell us just what is the UP Health System and what's your Michigan footprint look like?
So, first of all, thanks for having me. Super excited to be here. UP Health System is located in Marquette, Michigan. We are the Level 2 trauma center that provides specialty care for the entire population and communities of the Upper Peninsula. So we support the other 12 critical access hospitals, and we also have a Level 3 NICU. The closest Level 3 NICU is either across the state line in Wisconsin, or you have to cross the bridge to come downstate. So we provide all of the care that is required of a Level 2 trauma center.
And we've heard a lot about the critical access hospitals during the course of the conference here. What's going on with critical access?
So I would say in the UP, I don't know if we're necessarily unique, but I feel like we're unique because I talk on a regular basis with all of the CEOs and presidents of the other critical access hospitals about the importance of collaboration. I need all of them to stay open. I want to provide for that higher level of care that they're not able to provide there locally. So again, keeping all of them open and being able to provide that care is super important in the UP.
So, of course, emergency care, labor and delivery has to be delivered hands-on. Are there some services that maybe telemedicine works into or other remote technologies for your part of the state?
So we do a lot of outreach across the UP. We do have some telemedicine that we use, but keep in mind there's a difference between rural and then rural in the UP. So when you're looking at the broadband and the structure, not a lot of those communities are going to have the internet access or the capabilities to be able to support what I would consider to be 100% deliverable telemedicine support. But we do provide it where it's appropriate. We also do outreach clinics. So we do have a specialist from the UP Health System Marquette facility that will go out to those outlying clinics to be able to see patients there for their pre and post care. And then if they have to have procedures done, then they can come to Marquette for those procedures.
This is a policy conference. If you had to think about one or maybe two policies that you'd like our state legislature or the U.S. Congress to be thinking about, what would most benefit you and your constituents?
I think it's having a true understanding of the needs of each specific community. Every hospital is going to be a little bit different. The patient populations that they care for is going to be a little different. In the UP, our growing population is the aging population, which takes up 40% of resources. And so when you're talking about Medicaid cuts or Medicare cuts, there's a trickle-down effect that impacts so many things in being able to care for that patient population. A lot of people don't realize, when you're aging and we can't safely discharge you home and say we need to look at a skilled nursing facility, there's a Medicaid component to that that they have to be able to qualify to be able to help pay those additional costs. So I think it's when you're looking at different policies, it's having a true understanding of the entire impact of one decision because it's not insulated.
Yeah, and is it hard to get your voice into the mix?
I would say being a part of the Michigan Health and Hospital Association as a board member for the past year has really allowed me to spend more time in Lansing and meeting with the key policy makers and decision makers to have those conversations to kind of let them know this is what's happening in the UP of Michigan and this is how this decision will impact our ability to provide care.
And, of course, affordability is the word on everyone's lips, and it seems to have different contours for your patient population. What kind of things would make your life a little easier or better able to serve?
I think it's having an understanding of how healthcare is delivered. And that could be from a staffing perspective, it could be from a supply perspective, it could be from a technology perspective. It's also having an understanding of the age of a particular facility, the infrastructure that exists there, because it's easy to say you can roll out telemedicine as an example, but if you don't have an understanding of what the IT infrastructure is that exists at that facility, then it may not work. And so again, it's having just an understanding of not just the geography, but the facility, the patient population. In the UP, we're also unique, from a weather perspective. We have to figure out, like, how are we able to get those patients to our hospital year round? The bridge closed how many times this year? Getting patients across the bridge wasn't possible. So how do we get those patients then to Marquette to make sure that we can provide that higher level of care? So EMS is a huge component of that. So when you're looking at being able to get a patient from point A to point B, who's providing that transportation? Oftentimes those communities rely on either subsidized EMS transport or commercialized EMS transport. If that doesn't exist, then they're waiting hours for us to be able to come pick them up to bring them back to our facility.
A huge access issue.
It is. So we're 30% of Michigan's land mass and 3% of its population.
It's a formidable challenge.
Yes.
What final comments do you have for the audience today?
I would say, make a point to get out and know your local community hospital, understand what their obstacles are, ask questions. I think that's an important thing too. And it's also having an understanding of your own insurance. Oftentimes when people get frustrated, that's where the frustration comes in. Not understanding what your insurance plan is providing for you and getting to know who is the person that I can speak with to help this make sense for me.
Thank you so much for spending some time with us.
Thank you.
We've been talking with Tonya Darner. She is the Market Chief Executive Officer for the UP Health System, Marquette and Bell. And on behalf of the Michigan Health and Hospital Association and the Common Bridge podcast and Substack page, this is your host, Rich Helppie, signing off.